return to work guidelines. The purpose of these requirements was to ensure that all workers returning to work by the reopening date are safe and healthy, and that COVID-19 is mitigated from spreading in the workplaces. Some of the requirements mentioned include 1, assessment of non-essential work and working from home; 2, commuting to work, safe passage to and from work; and 3, the work injury insurance. This stated that, and I quote, "Every employer shall obtain and maintain an insurance policy with an insurer registered by the Insurance Regulatory Authority in respect of any liability that the employer may incur under Work Injury Benefits Act 2007. End of quote. Our topic today is insurance in the age of COVID-19, focusing on our most valuable assets as employers, our employees. According to the WHO updates on COVID-19, the world has close to 28 million cases, including 1 million deaths. However, more and more economies are opening up, meaning more and more of our employees are going back to work physically. It is therefore important for employers to prepare adequately and avoid any exposures for the employees. Our focus today will be on debunking these DOSHS return to work guidelines, exploring the extent of WIBA coverage, and preparing for our employee welfare in a post-COVID environment. So the questions we need to ask ourselves today: 1, is our WIBA policy adequate? Are there any exposures for ourselves as employers and for our employees? Do we really understand the policy for the benefit of our employees? Do we even have a WIBA policy in place? And if we do, is it with a reputable insurance company? As we proceed, we'd like to hear from you. Kindly insert your comments and questions in the Q&A chat box, and we shall discuss them at the end of the session. The webinar will also be structured into 3 main parts, after which we shall be having a poll. Your participation will be very invaluable to us. The webinar will be uploaded onto our various social media channels within 48 hours. Let's continue the conversation there. My name is Mwihaki Kafura. I head the Life Division at Zamara. I provide leadership and strategic development to my team, as well as building and maintaining relationship with our diverse clientele. I'll be a moderator today, and I'll be joined by my co-moderator, whom I will allow to introduce himself. Fred?
Hi, as Mwihaki has mentioned, my name is Fred Mushina. I lead the general insurance team in empowering individuals and businesses through financial and insurance solutions that enhance their financial well-being. I am privileged to be part of this largely experienced panel and look forward to a very informative session as we debunk the issues that affect our staff during this pandemic, with a key focus on the post-COVID environment. As part of our panel this morning, we are honored to have Mercy Mwirigi. Mercy is an Assistant Director, Human Resource Management and Development in the Judiciary, with a career spanning over 10 years in public service. Mercy holds an MBA in Strategic Management, a bachelor's degree in Education, graduate diploma in Human Resource Management. She is a member of the Institute of Human Resource Management, a certified professional mediator, and a corporate trainer. On several occasions, she has been published widely through articles and interviews published by the Daily Nation, Business Daily, and the East African. Highlights of our skills and experience include court administration, management functions, coordination of training and development functions, development of performance management systems, and overseeing staff appraisal, design and implementation of training programs. She is a wife and a mother of 3 children. She writes for fun, enjoys gardening, and engages in community development and youth mentorship programs. Karibu sana Mercy. Queer. Brian has over 25 years experience in the insurance industry. Mr. Akwir is currently the Senior Manager General Insurance Business at Association of Kenya Insurers. He is a certified Chartered Fellow of the Insurance Institute of London and a Chartered Fellow of the Insurance Institute of Kenya. He also holds a master's degree in commerce in Nagpur, India. He is the immediate past director of the Insurance Institute of Kenya and previously worked at Jubilee, GA, and Canon Assurance. Mr. Akwil also serves as a part-time lecturer. Karibu sana, Mr. Akwil. Finally, we have Dr. Andrew Muruka. Dr. Muruka is currently serving as the and the head of National Institute of Occupational Safety and Health Kenya for research and training in all aspects of occupational safety and health. He is formerly the Health and Safety Manager at KEMRI Wellcome Trust Research Program, Center for Geographic Medicine Research, Kilifi. He has vast experience in occupational safety and health with a demographic history of working in both government administration, private industry, and teaching undergraduate and postgraduate students at Kenyatta University and JKUAT. He is skilled in OSH policy development, enterprise OSH risk management, business continuity planning, fire and first aid management, emergency response and preparedness, special interest in workplace comfort and workplace JKUAT, Kisii University, University of Environmental and Occupational Health, Japan, and Swedish National Institute for Working Life. He is currently a PhD candidate in biorisk management at Kisii University. On the sidelines, he has also authored a book titled The Savannah Trees in Connection. Thank you and welcome, Bwana Muruka. We will now have our first poll question as displayed on your screens. We ask the audience to take a few seconds to respond. Now, the poll question is pretty straight. Have you carried out a risk assessment in line with the DOSHS return to?
All right, I think we are waiting for my technical team to put up the poll based on the queries that I can see. All right, maybe just give them one more minute. Okay. All right, I think we'll just proceed in the meantime as we wait for the technical team to put up the poll. Would prefer the poll responded via the poll rather than
Oh, sorry. Okay, Mr. Mulko, I don't know whether you got my question. Maybe I can go at it again. The OSH, the Occupational Safety and Health Return to Work Advisory dated 29th June 2020 has a number of requirements that employers are required to put in place before the reopening date. The Association of Kenya Guidelines recommended that these guidelines should actually be filled before the reopening date to ensure safety of staff. What duty of care does an employer owe to their employees during this time?
Thank you, Fred. All employers have a duty to protect their employees from contracting COVID-19 at the workplace, and if possible, for those who are working at home, even for those who are working at home, as long as they are on duty or in the course of employment. So it is an obligation of the employer to ensure that employees are safe and they are also not able to transmit this or to transmit this disease to other employees. So in general, all employees, of course, they also the duty to visitors, to ensure that visitors are also safe while in the premises of employers. Thank you.
Thank you, Dr. Muruka. And further to that, are there considerations that employers should be looking at where such items as unpaid leave or sick leave, sick off during quarantine or working from home are considered?
Sorry, just come again, please.
Are there considerations that employers should be looking at where items such as unpaid leave or sick off during quarantine are considered?
I think the main focus should be on ensuring that employees are safe and that they remain healthy throughout the process. So during quarantine, which is part of a treatment time for COVID-19, it is important for employers to take consideration of the fact that it is not the employer's it is not in the employer's interest, the employee's interest to go to quarantine. Nobody wants to go to quarantine. Nobody plans to go to quarantine. So it is just, bad luck that somebody has COVID-19 and is required to go to quarantine or self-isolation. Thank you.
Okay, thank you. Maybe we can go to the next question.
So just for Mercy, this one is for you as the HR director and expert. The Employment Act defines the benefits, duties, and obligations of the employer and the worker. How should employers ensure that they are compliant to this return to work guidelines? What considerations should we be looking at based on the Employment Act? Mercy?
All right, thank you very much, Mwihaki, for that question. What we should, the employers are guided by the Employment Act and various laws governing employment, and the issues around health, safety, and welfare of an employee are articulated very well in the WIBA Act and also in the OSH Act. So some of the issues that employers must look into, of course, begin with ensuring that the place of work is safe. So the Ministry of Health has come up with elaborate containment measures, has come up with guidelines on how people should, the social distancing issues. So employers are required to evaluate their workspaces and ensure that the spaces are adequate for the people who are coming to work, or if that is not the case, and then come up with policies or guidelines to support people who can work from home. Then, of course, the other issues in enhancing hygiene. We have seen a lot of need for enhancement of hygiene at the workplace. So issues of cleanliness, sanitization, wearing of face masks, that's an obligation and for the employer to ensure that the employees are well covered. Then again, apart from just providing those issues, then the employer requires to communicate and keep on sensitizing their employees to observe those measures. Remember, even when you're working at home, then you need to protect yourself, because should you then come back to the office and probably have been a bit careless, then you become a risk to your colleagues. Then other than that, there's the issue of now the insurance, for instance, to ensure that your employees are protected in case there's a liability arising out of illness, not necessarily probably COVID, but to ensure that their health and safety needs are well taken care of. Thank you.
Thank you, Mercy, for that. I think that is very clear. And just one more question now for Mr. Queer, with regard to ACI as a regulator. How should we be interpreting the work injury benefits policy, especially where a good number of our staff are working from home? We noted that insurance companies have various interpretations, especially at this point in time. And based on those various interpretations, it will therefore affect the interpretation of the DOSHS guidelines and also the ACI circular that was dated 29th of July. So how exactly should we interpret this WIBA versus group personal accident? Mr. Queer?
Thank you, Kabura. Looking at our situation, it is the new normal. WIBA policy, as you may be aware, under the COVID, we look at COVID from two fronts. COVID as the insurance contracts were, and COVID's for future insurance. So we need to put that demarcation. When we talk of COVID as the insurance policies were, and you want to define a work situation in the normal understanding of a work situation, it may not be accommodated. But then, can you keep an employee in an environment that is not safe? The answer is no. So I think in terms of futuristically, underwriters must look at the new normal and redefine the workplace. Thank you.
That is very clear. I agree that it is important for us as the industry as well to ensure that we redefine, as you have said, the workplace based on the new norm. All right. Now we are going into the next poll. I don't know if my technical team is ready. Okay. All right. Okay. We'll just hold on to that. I guess we will ask the rest of the poll questions when that is available. So we will move to the next item where we want to focus also on the WIBA coverage, the extent of the WIBA coverage at such a time as this. So again, to you, Dr. Muruka, we have established that WIBA compensation is mandatory, statutory, without which our employees are exposed. Now, when an employee is working from home and gets injured and the employer has only taken out a WIBA cover, assuming that this is not an enhanced cover, who exactly determines whether the claim is work-related, and will there be any exposures that can actually lead to employer liability suits? Dr. Muruka?
Thank you, Mihaki. I think first of all, I want to demystify the definition of a workplace. And I want to refer to the Occupational Safety and Health Act, Section 2. And the workplace is defined as including any land, any premises, or any location, or any vessel, or anything at, in, upon, or near which a worker is in the course of employment. So that is a very broad definition. It covers broad categories of workplaces. And therefore, a workplace for a factory worker, for example, or a machine operator in a factory may not be the same as a workplace for a salesperson or a sales manager who has to walk across town or everywhere else looking for clients and so on. So it will be defined in accordance with the work activity that the employee is involved in. And now going to your question with respect to working from home. Both the Occupational Safety and Health Act and the Work Injury Benefits Act refer to a person, or they refer to a person who is in the course of employment or who is on duty. So those two aspects must apply for somebody to be considered for any benefits or for any actions required under these acts of Parliament. So it is possible that if you engage an employee to work from home, then it is possible that he is actually in a workplace. And this workplace, the only difference is that the employer may not necessarily know where this workplace is. Some employers do, of course. But most employers would not be able to know where the employee stays, for example. And if you are engaging an employee to work from home, then it means that legally they are actually on duty. So if an employee is on duty, you still, that extension of ensuring that they are safe is based on yourself as the employer. Now, the funny part of all this, or the most difficult part of all this, is that you may not have access to this workplace. You may not go to this workplace and inspect it, for example, and ensure that it's as safe as what you as an employer would want to provide. So that will be the only difficulty, but that's just a difficulty. Difficulties have to be dealt with in accordance with the new situation. COVID-19 has actually presented a situation that was not known before. It does not mean that it is an abnormal situation. It is a new situation. So people must learn to work in the new situation, in the new space. The new space requires people to be insured. So people have to be insured. The new space requires that people must still continue to work safely. And I totally agree with Mr. Query on this. So employers are still required to ensure that workers are safe. But would they require, how would they do that, for example? Would they go to the home of the employee to inspect and then confirm whether it is safe or not? Or they have other alternatives to which they can ensure that these workplaces remain safe to the employee? Can they give out, for example, timelines or duration of work so that the workload does not exceed the employee? Can they give out key performance indicators and with specific outputs that employees are required to present within specific timelines? Can they require employees to adhere to specific guidelines? In fact, I have very good examples from another workplace here in Nairobi. And what they have done is that they have provided specific information on how to work safely from home, including how to set up a home work environment and to ensure that it complies with very basic safety requirements so that even injuries can be minimized. They have also provided information on how you can remain safe and be able not to contract COVID-19 while working from home, avoiding the red zones. We know the red zones, all the red zones, public gatherings, and recently you have seen political rallies and so on and so forth. So if you are not able to visit and employees are home to ensure that they are safe and to ensure that you are able to follow them up and ensure that wherever they go, they are safe. You have power to give information, and information is power. Information can keep you safe, and we know this from literature. So that's what I would say is my answer to that question. Thank you.
Okay, thank you, Dr. Muruka, for that expanded explanation on that. And I think now we go to the remedies, because when we talk about WIBA and injuries, of course, we know our employees are concerned in understanding what remedies exist in law. Now, this question goes to Mercy, and I in specific want to refer to Civil Appeal number 133 of 2011, specifically the Court of Appeal ruling dated 17th November 2017. And in essence, it was looking at the issue of the WIBA policy, benefits paid out under the WIBA policy. Can they be contested in a court of law under common law? Over to you, Mercy.
Thank you very much, Sheena. What maybe some of us may not be aware is that that appeal matter went all the way to the Supreme Court. The issues for determination in that case actually were around declaration of some of the sections of the WIBA Act to be unconstitutional, and the court held that the act is okay the way it is, and overturned the decision that had High Court decision, which was declaring some of those sections unconstitutional. So the benefits that accrue under WIBA Act include compensating employees for injury, compensating employees for either permanent or temporary disability, and probably in case the incidences are fatal, then in case of death. So they are legal and they can be contested in the court of law. In case there's an issue, in case the claim is not honored, the employee has a right to a court of law and have that right.
Okay, thank you, Mercy.
Just to add on to that, onto what Mercy has said, specifically that ruling, the Supreme Court ruling was, judgment was done on 3rd of December last year by Justice Maraga, Ibrahim, Wanjala, Joki, and Lenola. And what it did was specifically to dismiss the appeal that reinstate the position of appeal court, which had dismissed the case. So, and if I remember, one of the sections that lawyers, with due respect to any lawyer in the room, were fighting was section 16. The intention and the spirit of WIBA was that the act should be no fault act. But what was being fought was the reintroduction of common law and other sections that touched on some constitutional matters. So I think we have got updated position in terms of the ruling. The appeal one was way back in 2017. There's last year's ruling by Supreme Court. Thank you.
Okay, thank you, Bono Query, for that explanation. And I think now I'll just go back to you again with a further question as a follow-up to that. Yeah, ACI sent out a circular, Circular 85 of 2020, that advises the insurers to settle COVID-19 claims under occupational illnesses. This was based on Section 38(1)(b) of the Act, where COVID-19 can be contracted in the course of employment, hence an occupational illness. How should a proper WIBA cover look like? Mr. Query? Mr. Okwiri, a question to you. I think I need to get back to you over the same. Okay, he seems to be having a technical hitch. Maybe Dr. Muruka, you can help us in the meantime with that question.
I think Mr. Okwiri would be the best person to answer that question. Yeah, because I would like to see how the insurance sector addresses that particular aspect so that employees can be compensated when it is due.
Okay, I guess he's back. And Mr. Okwiri, can you hear us?
I think he has muted his phone. He has muted his. He's actually mute.
Okay, I think we'll just have to proceed.
Can you hear me?
Yes, we can hear you, Mr. Okwiri.
Okwiri, I didn't get your question. I think there was connectivity problem. Kindly summarize it so that I pick the keys.
No problem. I was just saying, AKI, Association of Kenya Insurers, sent out a circular yes. 85 of 2020, that advises the insurers to settle COVID-19 claims and occupational illnesses. This was based on the WIBA Act Section 8, 1B of the Act, where COVID-19 can be contracted in the course of employment, hence an occupational illness. How should a proper WIBA cover look like, in your opinion?
I briefly, if I'm to respond to that, it wasn't a global recommendation. Fortunately for WIBA, we have a standard WIBA policy. We know of late there has been improvement to bring in WIBA Plus. And the difference between WIBA Standard and WIBA Plus is that WIBA Plus is assumed to be under group personal accident. What does it mean? WIBA proper will cover employees when they are working, normal working hours. If it is from morning up to 5, beyond that, WIBA doesn't come in. So WIBA Plus came in to offer some sort of accommodative 24 hours. So our guide was that looking at the WIBA, particularly section 38.1, which you look at one is disease. So we were concentrating on disease because we have not had any claims arising out of injury. Section 38.1 qualifies diseases, Schedule 2. Schedule 2 states that there are a number of 40 diseases or exposures that are covered. Can you hear me?
Yes, we can hear you.
Yes, that are covered. Then after that, Part B of that schedule talks of other diseases. We have to come from the point of view, first of all, in terms of admissibility. When WHO stated that COVID was pandemic, it means that even for insurance companies globally, there's no insurance. Any loss that is under what we can refer to loosely as a fundamental risk are not taken up by private insurance companies. Those are taken up by the government. So even in terms of global insurance, response to COVID is not guaranteed. Standing, we looked at our situation and looked at that schedule 2 and noted that even though it's not mentioned as a covered disease or exposed, the other part says looked at under any other disease. And if the answer is yes, there's the issue of proving that indeed the cause of that disease is directly pointed to the work-related activities. Let me give 2 examples. An example where and there's a COVID claim. Even if COVID is not listed as one of the exposures, and somebody works in Nairobi hospital, and an insurance company says we can't pay, that is not correct, because it can be traced into the nature of work. Let us look at a worker in a flower company who is asthmatic and happens to have been directed to work in a cold room for night. And then his or her asthmatic situation worsens and dies. Now, whoever dies out of respiratory disorder, he said that this is COVID, this is COVID. Such kind of claim, it will be looked at from the practitioner, health practitioner's point of view, and they will indicate. So if you look at the cause of that death or disease, it's actually asthmatic related condition as opposed to the other one. So we were advising our members to look at the cover and see if one, explicitly there is exclusion of COVID. If there isn't, you treat cases as they come, so that you don't, in form of a blanket, refuse all covers. And we were looking at it because of the level of effect of COVID at that time. But globally, pandemics are not covered by insurance. Thank you.
Thank you, Mr. Akwiri. That is pretty clear. And I think as a follow-up question to Dr. Muruka, COVID-19 cases, to what extent do our health safety committees record it? Is it even for the asymptomatic individuals, or all cases must be recorded?
My answer is that how would you know that somebody is asymptomatic? It means that it is a case. So all cases actually have to be recorded. And just let me clarify how we want the advisory to be responded to in terms of employers. Number one, we want all employers to record all confirmed cases of occupational in DOSHS1 and submit those, the DOSHS1 for occupational safety and health officers, and also submit electronically to the Director of Occupational Safety and Health Services. The other cases that we would like the advisory to, the employers to conform to, is to report suspected cases. Suspected cases are not necessarily confirmed. Somebody can say that being suspected of COVID-19. And so long as they are occupationally exposed employees, then that is also supposed to be reported direct to DOSHS using DOSHS1. And the employer must stamp properly that this is actually suspected case. The other category of COVID-19 cases that must be reported are those that are called confirmed cases, but non-occupational. Everybody knows that if somebody was at home for maybe was on leave or something like that, he may have contracted COVID-19 during that period. And so it could be a confirmed case of COVID-19, but it is non-occupational. So those kind of data does not have to go into DOSHS1, but they have to be sent to the director as part of statistics of COVID cases among employees. And that also includes suspected cases of COVID-19, which are not occupationally exposed. So for all occupational exposures, DOSHS1 has to be filled, whether they are suspected or confirmed. Whether they will be finally confirmed or finally suspected and not confirmed, That is the work of the directorate to ensure that all cases that are not confirmed or just suspected are actually confirmed at the end of the day. Mr. Akwet talked about, and I think that was very good advice to insurance companies. Very good advice. Many countries, in fact, let me not even start with companies, labor organization. COVID-19 is, and there is a criteria, a 7-point criteria to diagnose occupational diseases, all of them, not just COVID alone. There are so many other occupational diseases that are contentious, and therefore that's why we have a program, a criteria for ensuring that each and every disease can be decided as whether it was occupational or not occupational. So ILO has confirmed that COVID-19 is an occupational disease. South Africa has confirmed that COVID-19 is an occupational disease. Israel, most parts of Europe, in the United States, and so on. So many countries have confirmed, but it must conform that 7-point criteria. It must be diagnosed as such by a competent person. So I want to add something small. Following up on the directives or on the advice from a query, we as DOSHS, we are going to revise this advisory in the next few days, and we are going to publish the names of all the insurance companies that cover COVID-19, so that it is easier for our employers to go direct to them instead of trying to, wander in the bush. So I think that will be important information to share with your teams, so that going forward, we are able to be very confident on what we are doing with and what we mean with what COVID is. Thank you.
Okay, thank you, Dr. Muruka. And I think now it's proper we only ask the next poll question here. And basically, we want to know to what extent is the organization ready for the eventual return to operations? Our technical team maybe can display. Yeah. We request the audience to take 60 seconds to respond to this question as we enhance the safety of our employees at work.
All right, okay, as we continue to answer that query, it's very key for us to understand, are we ready in terms of our policies? Are we ready in terms of our workforce? The third item there is our leadership ready? Are our facilities ready? Is our business ready as per the guidelines regarding planning to work policies, even as we wait for the date to be clear? Thank you so much, our panel. Coming up, I will just proceed and ask a few more here as we continue the queries and your comments. The Q&A section, please keep them coming. Maybe we start with Mercy here. With regard to a post-COVID environment for our employees, from a HR perspective, what are some of the best practices for employers to adopt during this period, just to ensure that we are ready whenever the reopening date will be? What are some of the best practices that we should have in place? Mercy?
All right, thank you so much. To look at in readiness for reopening of the workplaces is some of them, of course, include ensuring that the hygiene measures are put in place, as I had mentioned earlier on. We need to ensure that the facilities are re-looked into, you know, because before COVID came, our facilities, probably our offices were designed in a different manner. So as we allow people to come back to the office, what we should be asking ourselves is what changes have we done in terms of even structure, sitting arrangements, and that kind of thing. And then also ensure that cleanliness is maintained. A lot of resources need to go into cleaning and fumigation services so that our employees feel. Also in terms of facilitating our employees, for instance, when they're coming to work. Some of the things that employers need to look at is how do we support our staff to commute from their work from home and back, and keep on sensitizing them on the need for them to be to obtain the measures so that they are very safe. When it comes to still may not be able to go back to people coming to work as normally. So probably we need to look at the policy of working from home. And because we have realized that a lot of work can actually be done at home, all of us don't need to go to the work. So what the main policy that probably employers need to look at is how do we now come up with a proper working at home policy and provide guidelines. I'm delighted to hear that Dr. Miruka has quite a good number of examples on how organizations are facilitating the employees to come up from home, to continue working from home. This includes ensuring that you support employees to work from home, probably look at the kind of equipment that they require and the tools. Most importantly, you also need to look at the skill gaps that they require to be able to work from home comfortably. We need to look into the issues of productivity. How do we measure their productivity now that they are going to be working from home? What kind of targets will they have and how will they be appraised? We are looking at also these policies. We need to be very conscious that working from home. The majority of our employees could be parents or they have children. Children are at home right now. So flexibility in terms of working hours need to be looked into so that employees are not forced to be working at certain times when they are honestly not able to do that. So the Directorate of HR and people working in the HR and also the management need to look at how do we become flexible in terms of you know, the working hours, so it is not a straight 8 to 5. If some work can be done, you know, earlier or later in the day, that would be okay. And then most importantly, with regard now to insurance, I think a lot of conversations need to happen between the providers and employers, so that we look at how we can, we're going to enhance the covers that we have already existing. So they cover our employees probably around the clock. It's easiest to become an 8 to 5, you know, being a 20 cover, so that our employees are protected. Because again, as the director has said, workplace is not, you know, just being in the office physically. The definition of workplace includes all those aspects. So long as you have a relationship with the employer, and you are actually at the workplace. Other than that, come back. This has COVID has presented a very challenging scenario to all of us, arising out of fear, arising out of probably being infected directly or being affected. And these issues have caused a lot of strain to our employees. employees and people generally. So there's an issue, there's need for revamping or introducing psychosocial support for those organizations that do not have. Such continually employees are able to be supported in that regard. And where necessary, probably also have extend or review our medical covers to ensure that there is that bit of providing psychosocial support when need be. And then now with working from home, there are so many other issues that we are able to enjoy when we are at the workplace, and it's not possible to have those when we are working from home. I'm looking at even if the economy is opened up and we go back to normal, a huge chunk of people will continue working remotely because of the reasons that I have advanced before. So issues of ensuring that employee health all around physical and all that needs to be looked at. For instance, there are those organizations that will provide gym facilities, cafeteria facilities, and all those are normally part of a package to ensure that employees' welfare is taken care of. So how now do we ensure that the same benefits, the same services to our employees to enhance our employee engagement? How do we then now translate those two to people who are working at home? So there's a lot of conversation, there's a lot of creativity and a lot of flexibility that needs to be happening as we develop our policies moving forward to ensure that our employees are not only just healthy physically, but they are also emotionally and physically fit.
All right, thank you, Mercy. Looks like there's still a lot to be done by the industry and also from a HR perspective, just to make sure that we are prepared for the new norm. So we want to see the results of the poll. IT, if you could just give us that. All right, there we go. For the first query, we see that policy readiness, most of us are about moderate. And I think that is why we have this session today, so we can up that from just being moderate to a very large extent. On the workforce readiness, also see the highest percentage is 47% on moderate extent. So the question was what extent moderate extent or a very large extent. On leadership, we have, it's the highest, which is at 40%. So most of our leaders seem that they are a bit ready, or rather they're preparing for this opportunity when it comes. Facilities, and this is one of the items that we talked about. I mentioned that large extent are ready in terms of their facilities, and for the business readiness, also a large extent is ready for their new norm when people get back to work. So it seems we are not doing so bad, and I hope that by the end of this webinar we will have moved to the next position of being very ready. We'd like to answer a few questions here. All right, so thank you so much, everyone, that you've placed your questions here on the Q&A, quite a number of questions. Let me start with one from Maureen. Does the DOSHS guidelines create any obligation for the employer? Are they to be adhered to strictly, or are they enforced? Dr. Muruka, what do you think? Are they to be adhered to completely, or can we talk?
Thank you, Mihaki, for that very, very important question. Are the guidelines the guidelines could be very persuasive to ensure that there is loss control systems administered by workplaces. These guidelines do not add any new obligations other than what is already provided for under the occupational that the word COVID-19 appears in that policy. That's the only thing that has been added. We didn't have to do that because all occupational diseases are actually compensable, all of them under the law. In terms of things like registering of workplaces, again, we don't have to write that. It's already provided for in law. We're just trying to remind businesses that there are certain, apart from the simple things that you need to do, there are additional measures that you can undertake to ensure that people remain safe and your workplace to visit and to work. So there is nothing new. When we talked about issues to do with mental health, of course, we know that there is a big elevated mental health. Initially, we were talking about between 11 to 70% of the workforce having some form of mental illness. With COVID-19, it is tending towards 90. And if we collect real data, probably it is 100% of the employees, because this COVID-19 is a very high risk in terms of transmission. So the level of fear on the level of fear related to a particular type of risk at the workplace. So we know this. And the knowledge levels have also gone up with respect to COVID-19. So that also raises the fear. The other thing that has raised the fear is the level of awareness. A level of awareness about COVID-19. So all these factors, including perception of the risk itself, knowledge and awareness levels, have actually led to high risk of a perception of mental illness. So mental illness has gone up, and that is why we are asking enterprises to do something about this, to engage employees who may be exposed or who may have something to say about the risk and how they need to be helped in terms of mental health. So we have not introduced anything new. Even mental health itself is something that employers are required to do. Under Section 6, subsection 3 of the Occupational Safety and Health Act, the issue of risk assessment is an ongoing obligation. So there's nothing new. The only thing that we added was trying to raise the bar in terms of awareness about what employers need to do urgently to maintain or to reduce or to minimize the loss that could be associated with COVID-19. Thank you.
All right, thank you for that. I have another query here for Mr. Akwir. And I think we have touched on this briefly, but just to be very clear from a regulator point of view. So since pandemics are excluded within the insurance policies, what changes do you expect to see with regards to such uncertainties going forward? Our audience here is referring to terrorism. At one point was an exclusion, but after Westgate, we note that most policies have now included passive terrorism as one of the benefits that is actually covered. So what do we expect with regards to pandemics such as COVID-19 going forward? Dr. Akwir, Mr. Akwir?
Yeah, Mr. Akwir, thank you. I wanted to pick that up, and I happen to directly be involved in trying to get cover for post-violence and the terrorism acts cover. It was a daunting experience. We had several meetings with local, regional, and even international insurances. At that point, it was a hard nut to crack. What we have now is it will normalize with time. But I think my view in terms of going forward, we don't need to restrict it to COVID alone. There are other pandemic diseases that are likely to future. So the contracts that we will be having in future already we are aware of the need for response. And I guess that's one of the reasons why we have this engagement, that going forward, we insurers must respond to this requirement. In our discussion yesterday, I also gathered from Zamara that already some of your clients are getting this cover. The main challenge has been the reinsurance, and I don't want to go to that. That is some bedroom activity in terms of equipping ourselves. But the cover that should be in place as we move forward should be very clear, explicit, to either include or exclude. When you talk of pandemic, it is global. When you talk of localized diseases, regional also like Ebola. So when we talk of this cover going forward, what is it that insurance companies must do? Of course, the terms and conditions of the cover must be relooked at. What do I mean by terms? The premiums, the rating structure that are there, the limits of cover, because your cover can be there so long as the limits can be accommodated, and it is even affordable, because you don't create a cover that nobody can afford. We need also to recognize the fact that there are obligations. These obligations are the ones that actually they are statute. And that's where the OSH comes in. There are certain obligations that all the employers are required to do in order for a risk to be normal and insurance companies to come in. One of the conditions, for example, and as we talk, I guess to some of the insurers, I want to bring in this issue of declaration. WIBA policy is a declaration policy. What does it mean? We have been playing some game as insurers and insureds from this point of view. When the list of employees are submitted to insurance companies, they are hidden, or we carefully combine information so that the insurance company does not have clear taken at deposit premium, which normally is around 75. When the year ends, all employees are required to resubmit the actual position of their employees within the year, so that insurance companies can look at what they were covering on deposit and adjust the premiums at the end. What we are doing is that we are concealing information. When claims come with insurers, insurers can send an auditor to get a true position of the number of the employees that were there. And now you find that was volunteered was not correct from HR practitioners, mainly on behalf of the companies. So my plea is that let us be transparent as we move forward, so that whatever cover that we will be coming up with is cover that is bedded on the statutory requirements, which in our contracts we put under warranty. And our warranty is a condition that goes to the root of the contract, so that if you are required to clear, to make your workplace safe, and it happens on inspection that your workplace is not safe, an insurance company can quote that section of a statutory requirement that you didn't meet this obligation. And on the basis of that, we are refuting this claim. And even if it goes to court and it is proved, the court proves that certain statutory requirement was not met, that claim can be defeated. So my advice is that as we move into future, I know insurance companies and the technical committees are already working on this. And it will be like political and terrorism, political violence. We will get into it. The premiums for political now is very nominal, allow me to mention. But I think we must ensure that the covers that we get, when you want to get a WIBA cover, make sure that it explicitly covers you for that. If it doesn't, then you know that you are not covered. And we have also noted that out of this is mainly disease. For COVID, WIBA will hardly touch on injury. So there is another policy, and I guess most HRs that are with us and insured, there's group medical insurance. That is the specific policy that comes into play immediately as an health problem or disease. So where you have a medical or health insurance, make sure that in that policy, COVID is also insured, because it is the policy that first responds to diseases or health issues. The part B of WIBA is a complementing benefit. Thank you.
Okay, thank you, Mr. Akil, for that comprehensive response. And I think I have one from audience here for Mercy. Mercy, what is your advice to employers when it comes to employee data and information protection, especially if we must inform the Directorate of Occupational Safety and Health for non-occupational COVID-19 cases? What is the role of the Ministry of Health here?
Thank you for that question. When it comes to data, there are general laws that we have. Sorry about that. We have general, working from home has its own challenges. I might now have to take a whip and whip somebody. Sorry about that. What you're talking about, I hope I'm not going to be penalized for that. Sorry. My comment is that the Constitution guarantees the right to protection of personal data, and I think we have a statute on that, Data Protection Act, which categorizes health data of an employee or of any other person as protected and confidential. But again, so the question that we need to be asking ourselves is, for what purpose are we submitting this data? And I think for purposes of DOSHS guidelines, I think that's safe space, as opposed to whereby you're just publishing information about COVID status of your employees just for general purposes. That I think would be wrong in my view. The role of the Ministry of Health, I think the role of the Ministry of Health is similar. Probably, Dr. you will clarify for us. I think what your office submitting data to DOSHS is quite lawful, and that should be done by the HR. Thank you. Dr. Andrew, probably you can clarify the role of your office and that of the Ministry of Health with regard to that question.
Yes, thank you so much, Mercy. I think Mercy has really covered the subject extremely well. In terms of clarifying the role of DOSHS with respect to this, I would like to go back to what I said earlier. What are employers required to submit with respect to non-occupational diseases? That is numbers. Those are specifically numbers. And I think I clarified that at the beginning of my presentation. Where we require the names are where there is somebody who has contracted COVID-19 in an occupational environment. That one must be submitted through DOSHS-1. DOSHS-1 is a form that is used to do that. The suspected cases must also be submitted through DOSHS-1. And that is why after that, they need to be investigated and confirmed whether they were occupational or non-occupational, so that we are able to know how occupational diseases, the epidemiology of occupational diseases across the country and across workplaces. That is important. We have the mandate to process compensation, so that's why the information must have names. Thank you.
Thank you, Dr. I believe actually you've disarmed my next question to you, but I'll not try asking you some of these questions.
Yes.
Now we have another question from one of our participants, and Dr. Muruka, we would like you to articulate the 7-point criteria to diagnose occupational disease that you have mentioned. Maybe in brief.
Okay. Let me share my screen. Is it here? I will be sharing a screen shortly, so that I don't miss any point related to that. So the diagnosis of an occupational disease is a clinical decision-making process or applied epidemiology decision. It is not an exact science, but there are certain questions that before a decision is made that a disease is occupational, it must meet. Number one, there's what we call the strength of the association. And this means that the greater the impact of an exposure on the occurrence or development of a disease, the stronger the likelihood of a causal relationship. Then there must be consistency. Consistency in the fact that different research reports generally would return similar results and similar conclusions. For example, if they are investigating disease in India or in China, it must have elevated levels of COVID-19 amongst those who are exposed against those who are not exposed. So there must be that consistency in scientific reports. Number three is what we call temporality or time sequence. In other words, the disease must precede exposure. So the disease, exposure comes first, then the disease follows in a time or a time sequence. So there must be a time period within which you are exposed and you get the disease. And that is why there is an issue of contact tracing. So if you are able to trace that contacts until to a workplace, then probably we'll say that that would be an occupational disease. Number four, there must be a biological gradients. That is the level, the greater the level and duration of exposure, the greater the severity of the disease. And of course, the severity of the incidence. Then number five, it must also make biological sense. From toxicological data, chemistry, physical science, and all that, it must make biological sense to suggest that exposure leads to the disease. One of a very good example of this is what happened in the United States recently. When they reopened, there were several exposures among waiters in the United States. And this could be directly related to exposure. So they could trace where this exposure occurred. Then number 6 is the issue of coherence. Coherence simply means that if we look at all the evidence, all the data, epidemiological studies, they must conclude there is a cause and effect relationship in a broad sense. And in terms of general common sense, it must show that all the evidence suggests that this disease is actually related to this outcome, or this exposure is related to the outcome. The other one is the issue of interventional studies. If we remove the exposure, it should lead to no disease. But if we remove the exposure and there's still disease, then that does not indicate a causal relationship, and therefore that would not be an occupational disease. So this 7-point criteria must be met for an occupational disease to be decided as such. Of course, there must be a causal relationship. The exposure must lead to disease. And this is where the job is actually. Thank you.
All right. Okay, thank you. I think, Dr. Muruka, that has answered most of the questions. There's still so many questions coming in. We have about maybe 10 minutes to go. Before I give the panelists the last, just a 1 minute to give us a conclusion, maybe just one last question here. In cases where companies are to renew their workplace registration certificates, and I think this is from Mercy, are the new normal guidelines to be included? Have these forms changed to accommodate the COVID-19 guidelines like social distancing?
Can you repeat the question again, Mahaki? I didn't get the question quite well.
All right. So this question from Edna is with regard to workplace registration certificates. And the question is, in cases where companies are to renew their workplace registration certificates, are the new normal guidelines to be included? Are these forms changed to accommodate the COVID guidelines like social distancing? Have there been any changes there?
Thank you. I think what we need to understand is that the normal health and safety audits are totally different, in my view, from the COVID audit, and should be treated separately. So it should be a repeat. If you have not done the COVID audit assessment before you open up, then that one has to be complied with, which is very different again from the normal health and safety audit. So that there are two different reports and they should not be mixed. So the aspects that are there in the guidelines, they should be complied with, and every enterprise that requires to reopen then must go through that and have that assessed once again, and the report filed.
All right, thank you. A lot of clarity in there. Maybe just one question. Are there any specific guidelines from DOSHS? I think this one we've already talked about it. Let me just keep that for now. Yes, just one last one here. Are some employers risking very costly decisions for a temporary time, or do we consider COVID that will last? I don't know how we're going to answer this. Or do we consider COVID will last pretty long? For instance, moving offices, glass screens around the desk, private transportation. Allow me to go back to Mercy on this one. How do HRs feel as employers with regards to the cost of all these changes that are happening now? With the view that they could be temporary, they could be temporary, we're hoping that maybe COVID at some point will end and you can all come back to the old normal.
Of course, COVID has brought in a lot of challenges. Organizations have really struggled in terms of resources. We are all aware the initial costs, even before they came down, the initial cost of basic items like even hand sanitizers and thermal guns, and all those things was so huge. Actually, that is one of the reasons why probably some of the organizations had to shut down, because they could not meet those operational costs. So yes, the organizations are actually grappling with those costs. But again, from a HR point of view and of course from a legal obligatory point perspective, is that this health and safety of your employees then rests with the employer. So moving forward, I think we are seeing rearrangement in terms of how we are going to apportion costs and how we are going to be budgeting for items. And again, this is a new experience for everybody. It hasn't been there before. So again, we go into policies with regard to budgeting and finances, giving priorities as organizations, so that we take care. We have probably even a kitty or an emergency fund somewhere, so that we are not caught flat-footed again, or we have at the back of our minds, we have provisions that can attend to some of the emerging issues that pose risks to our employees and staff. Other than that is to have a very flexible policies, and also ensure that you have policies that can actually be quickly, modified to suit emerging issues and emerging trends. But having said that, again, the health and safety of an employee remains paramount, speaking from a HR point of view. And regardless of the cost, I mean, that is your best. You want to make sure that your employees feel safe. You want to make sure that your employees feel protected even as they come to work, for them to be able to work optimally. Thank you.
All right, thank you. We have had quite a conversation in that almost 1.5 hours, and I just want to let our panelists, even as we come to the end, just give us a conclusion, just a 30 seconds conclusion on these items that we have discussed. I believe that this will be shared in our, as I said, in our social media channels, and any other queries that are there that we've not answered, we'll definitely ensure that we also answer them there. So I will start with Dr. Muruka, just 30 seconds final words for our audience.
Thank you very much, Mwihaki. I think first of all, I want to acknowledge your best choice of panelists. They have really articulated DOSHS as a very good ambassadors. I particularly Director Murigi and Mr. Akwir, they have really articulated the issues the way they are supposed to be. And I believe that the insurance industry is well advised. And even employers are well advised on these items right now. Thank you so much for inviting DOSHS to this discussion. We feel privileged and honored to be here. Thank you.
Thank you. Thank you so much, Dr. Muruka. Mr. Akwir, our final words?
Thank you. And let me echo what Dr. has mentioned. We are grateful and hope that we'll have more exposures of this nature so that we educate ourselves. One, allow me to appeal again to employers to observe the OSH statutory requirements because they go to the root of WIBA contracts with insurers. Those obligations should be met. Secondly, I would like to also encourage particularly the insurers who are listening to understand their insurance contracts, not only for WIBA, but all the contracts, so that you know what to expect from insurance companies, and the insurance companies knows what they are supposed to do in terms of response. Finally, I would like to appeal to HRs and by extensions by extension, the employers, not to conceal information and give only information that would make them to pay very little premiums. You are in a contract, and the more information that you give in terms of the salaries, in terms of job categories, if a cover is on named basis, names of those employees, and nature of their work, so that you enable the underwriter to charge you properly, give you a contract that will resonate with your insurance requirements. Thank you.
Mr. Akwiri, that is very important for us to share as much as information as we have for our benefit and that for the employees. Mercy, your last words?
Mine is also to echo the sentiments of my co-panelists who have done exceptionally well. Dr. Andrew and Mr. Akwiri, thank you so much. It was a pleasure here listening to you and learning so much about the role of insurance, DOSHS guidelines, and HETAR as we move together. My take home is that there's a lot of conversation that needs to happen, and I commend Zamara for organizing this wonderful platform. It has been quite an eye-opener to majority of us, I believe. And from even the polls, you can see that quite a good number of organizations are not ready. The highest percentage was ranging at around 40 in the aspects that you had looked into. So that says that tells us that you have a lot of work to do, so that we ensure that our workplaces are safe. We also ensure that in case of anything, our employees then are well covered. Finally, to our insurance providers who are here, I think it has also come to us as HR practitioners or those people who negotiate those contracts that I think either we don't understand really, or we are in a hurry, or you guys use very technical terms. So kindly engage your clients, talk to them, walk to those offices, take them through those clauses. And I believe some of those who give you half-baked information probably because they're looking at the cost. But again, that is room for engagement. So they understand that whether you hide this information or not, it's not for your benefit. Eventually, something will catch up with you. But generally, I'm excited. Thank you very much.
Okay, thank you very much, our panelists and my co-moderator Muihaki. And I would like again to echo Director Mercy's words that we need to all play our parts. And as Zamara, powering prosperity is a key value of our brand promise. And with that, we as Zamara are open to assisting all our clients in understanding the clauses therein, especially for the WIBA, the medical, and the group life covers, to check the adequacy of benefits during this age of COVID and post-COVID. Asanteni sana. And we, to the audience, we would love to hear your feedback regarding our webinar. Can you take a minute to fill out our survey after this session? Have a great afternoon ahead. Thank you.
Thank you very much.
Thank you.
Thank you very much.
Thank you, Dr. Daktari, Director Mwirigi, and Mr. Akwiri.